In 2015, we started the student clerkship program here. Since that time, we've had 38 students do an 8-month rotation through our clinics here. And so that was the starting point of really wanting to get in the clinical academic environment. So from when I started to now, we've seen some exponential growth. A lot of it on a grassroots aspect. We also note is that musculoskeletal care is one of the #1 complaints that people come in with. And so if we have direct access providers that are chiropractors, physical therapists, etc., that can take some of the load off of primary care and manage the musculoskeletal conditions, it provides them a lot of opportunity to manage a lot of the other things that they need to.
Primarily, we work with patients who have spinal pain, so like neck and back pain. That's what most people think of chiropractors for. But we also, we globally work with the musculoskeletal system and then the neuromusculoskeletal system. So how the nervous system interacts with our bodies, basically. So we have a lot of patients who have peripheral neuropathies, who have conditions that they might also be co-managed with a neurologist. So that's part of our job, and one of the kind of complicated or complex parts of the job is treating patients who have more comorbid conditions or more complex conditions.
A few years back, I had some very painful back issues, and I tried to. There was not a chiropractor here within the system. I had to use the civilian system, and long story short, it literally took weeks and weeks and weeks before I could see anyone. Now, every 6 weeks, I come in for maintenance. I haven't had any severe back problems anymore, and the system for me is really working well.
We are the largest town for almost an hour in any direction. So honestly, it's fantastic having a chiropractor right here in the clinic with me, because we are constantly collaborating back and forth with each other. Yes, we do have a lot of the same skills and we are able to offer a lot of those same services, but we're also very distinct and unique in our own ways. Our exams sometimes have to go above and beyond what just the typical orthopedic physical therapist is going to give. We're doing home assessments, we're doing equipment fittings and assessments, which I think is something that you don't get outside of the VA. So because we can offer wheelchairs and canes and crutches and power lifts, these are not things that you get exposed to. At least I didn't get exposed to when I was a student at other clinics. When I was at the VA, I got that exposure, and so I felt much more comfortable when I was a student working at other clinics, having to fit that knee brace or understanding how to put that motion control knee brace on, because I had been doing that already as a student at the VA.